everybody, it's Drew. It's been a long time since I made a video. I think 4 or 5 years. I don't know, maybe not that long, but it's been a long time. And the reason I'm making a video today is because as of today, I believe I am 3 weeks post-op for top surgery with Dr. Medalie, who's in there around Cleveland, Ohio. I've been on testosterone now for over 8 years, and I've been able to essentially get away without having top surgery for so long. I just wore a bunch of layers and didn't have a very large chest to begin with, so I was able to put it off, which was not the greatest. Wish it would have been done sooner, but better late than never. So I'm really excited I was finally able to have surgery and go through with it. For the past couple of years, I've been trying to get my insurance to cover it, and I finally got them to cover it, or say it would be covered. But then the in-network surgeon I went to was not up to par, let's say. Started out the consult by saying he had no interest in having a transgender practice, but you take the good with the bad. So that's enough said about that. I decided to go with Dr. Medalie, who doesn't take insurance as of right now, but he's, in my opinion, he's the best in the area. I saw the most results that I liked from before and after. For my type of surgery, I had the Peri areolar, and it's the one where they only had to cut halfway around the nipple instead of all the way around. But yeah, so let's see. I'm going to try to make it quick because I'm sure you really just want to see the photos. I know that was how I was before. But yeah, Dr. Medalie went through the University Hospital Surgery Center in South Euclid. Everybody there was amazing. The whole staff, every interaction I had with them, from the surgery center to back at the office with my post-op visit, everybody was amazing. I opted not to do an in-person consult beforehand. Basically, it was at the point where I had waited long enough and I saw the results I needed from Dr. Medalie. There really wasn't any reason I wouldn't want to go with him, so I just did a consult over the phone. I emailed everything to to the office first. They sent me a price, and then we did a phone consult, and yeah, scheduled me for surgery, and I had it. Everything was good. I haven't had any complications or everything. I did take a lot of time off work, so I haven't been back to work yet. Want to make sure I heal and everything's good, even though I feel good. Body's still healing, so I'm trying to take my time and make sure everything is good before pushing myself. The most uncomfortable part about the whole thing was the drains. You got these drains that come out of your armpits. I'm sure you've seen other guys in videos with them. That was the most uncomfortable part. The most painful was just how annoying that was. And then second was the compression vest. Although it's super important, and I wore it for the full 10 days after the post-op visit that I was supposed to, it was so uncomfortable by the end. I felt like it was squeezing my rib cage more than it was actually like providing pressure on my chest. And by the end of it, I felt like my ribs were sore because it was too tight. But that's done. No more vest. Now I just have some bandages, which you'll see. We'll just get to that part real quick here. Yeah, so take the bandages off. Yeah, so here's my chest. I still have some swelling on this side, underneath here, and I don't have a lot of feeling on this side yet, like all of my nipple to over here. This side, I've got some feeling up here, but pretty much all here, there's no feeling, and it's very swollen right here. I don't know if you can really tell, but all of this is swollen, and I can kind of feel some hard lumps underneath, which they said it's normal, it can take some time. This side, which actually had most of the bruising when they first, after the first post-op visit, and they took the compression vest and everything off, I had some like major bruising all down the side. It was all yellow, and there were some like hardcore bruises. The most you can see is just this little portion. This little red spot was a big bruise right there. But yeah, so I'm trying to find the best way to show you. So far, I'm pretty happy. We've got the drain site here where it was stitched in, and then a little incision there. As you can tell, only halfway around the nipple. And same over here. This one went kind of further up. It kind of went a little higher up on one side than the other, but whatever. There we go. Sorry, I'm not used to the camera. Backwards, but yeah, so overall I'm happy with it. Yeah, I mean, there's one angle I think you can see there's still some bruising up there, but This side I've got most of my feeling back. Well, not, I guess not most. I've still got a little bit down here that I can't feel. I'm still waiting for the swelling, but it's only been 3 weeks, so still got some time. Yeah, overall I'm happy with that. I feel like it's asymmetrical a little bit, but again, I gotta wait for the swelling to go down. And what can you do? They're two surgeries. I know they do it all at once, but it's 2 separate surgeries, so you can't expect them to be the same. I'm hoping when the swelling goes down, it'll be a little better. But overall, I'm happy with it. Yeah, that's all I got for now. Maybe I'll make some more videos. Maybe I'll wait 5 years. We'll see. All right, have a good one.